Good afternoon, and thank you for attending today's seminar. We will get started in just a moment. Just want to give a few moments for people to log on. All right, well, let's get started. Good afternoon, and thank you for attending today's seminar on the impacts of environmental public health hazards on Hispanic communities. My name is Nicole Dutra Marquez. I'm a senior project coordinator for the National Environmental Health Association. I will be moderating the seminar today. The agenda for today's seminar includes a quick overview of who is NEHA, where I will provide some insight into our organization and our role in environmental public health. Michelle, the slides aren't showing.
Keep talking, I'll catch up with you.
All right. Next, we will introduce our guest speaker, an expert who will speak to you on the impacts of environmental public health hazards on Hispanic communities. Following the presentation, we will move into our panel discussion with 3 environmental health professionals who will share their stories of working in environmental health with their communities. Lastly, I will share with you some information on our 86th annual educational conference that's happening later this year. Allow me to cover a few housekeeping items before we get started. Please note that this webinar is being recorded. The recording will be uploaded onto our website, which is www.neha.org. We will take a few questions upon completion of our guest speaker's presentation and later during the panel discussion. Please utilize the Q&A box located at the bottom of your screen to drop in your questions. At the conclusion of the seminar, you will receive a link to take part in an evaluation where you will be able to provide us feedback and comments on today's seminar. With that, let's begin today's seminar. Before we talk about who we are, I wanted to take a moment to talk about our profession. While many don't recognize it, environmental health is the foundation of public health. As you can see from the World Health Organization, nearly a quarter of deaths around the world are due to a health risk in the environment. Environmental health refers to protecting humans from health risks that come from the environment, such as pollution in the air, contamination of food at a restaurant, or lead in a water source. Environmental health is also one of the 3 legs in disease outbreak. It takes all 3 professions to prevent and reduce outbreaks to protect public health. As an association, everything we do is to build, sustain, and empower environmental health professionals so that they're equipped and prepared to protect the health of communities across the country. Our most recent membership survey revealed that most of our members are working directly with communities at the local level. The survey also illustrated that our members serve all types of communities, from very small to very large. This map illustrates the reach of our fiscal year 2022 projects throughout the country. We supported and partnered with jurisdictions on about 768 projects. To support the workforce, we also invest in environmental health via funding from FDA and CDC on topics from food safety to land reuse. In fiscal year 2022, we invested nearly $10 million. Some examples of our investments were to support jurisdictions participating in the NEHA FDA Retail Flexible Funding Model Grant for food safety. Some were scholarships for our Leadership Institute, funding for tribal entities and U.S. territories building their environmental health infrastructure, specifically around childhood lead exposure, disaster relief, and vector control issues. And we also helped with Health in All Policy mini grants. Part of how we support public health overall and environmental public health specifically is by continuously providing training and education and offering credentials to certify the expertise of our workforce. In addition to our large online library of courses, webinar recordings, and resources, we host an educational conference every year that includes 14 different tracks, from leadership to emergency response to body art to communication. This year, we will be in New Orleans. We have a team of instructional designers who build online and in-person trainings and instructors who deliver courses to provide the latest in research and practice to our workforce. We also provide field training in the Pacific Islands. We offer 6 credentials that certify expertise of all facets of environmental health, as well as specific aspects of food safety practice. We advocate for funding and policy at the federal level for the environmental public health profession specifically, and public health generally. We also provide our members with regular updates on relevant national and state legislation through our webinars and blogs. We believe that part of building and sustaining our workforce is to provide opportunities for professional growth at many levels. We offer scholarships and internships to students studying environmental health sciences, and the first ever Environmental Health Leadership Academy for professionals already working in the field. Much of our work is connecting the right people together and serving as the leader support to set and meet goals that serve the profession and environmental public health. A few of our communities include the Private Water Network, Climate and Health Community, Concurrent Disasters Community of Practice, and Environmental Health Strike Team Standard Community of Practice. For our members, we provide an online social platform we call Community. It allows members to connect with each other, ask questions, and get tips. On the platform, we offer events like a quarterly 30-minute leadership presentation called Spark. We're also launching an Ask the Author pilot for members to ask questions and hear more from featured authors in our Journal of Environmental Health. We welcome anyone who would benefit from the research, education, advocacy, and connection we provide for the environmental public health community. And you can learn more about everything that we do at our website, neha.org. Now let's get to our topic on the impacts of environmental public health hazards on Hispanic communities. I would like to introduce our guest speaker today, Dr. Monica Ramirez Andriota, who is an associate professor of environmental science and public health at the University of Arizona. Monica uses an environmental justice framework and participatory research methods. She investigates exposure pathways and communication strategies to translate environmental health research to action and achieve structural change. Dr. Ramirez Andriota, the floor is all yours.
All right, thank you all so very much. It's an honor to be here. Let me share my slides. All right, and let's get started. Let me set my timer. All right, I got 15 minutes to do. Let's see here. Here we go. All right, thank you for that wonderful introduction. So I'm at the University of Arizona, and so we are on the land and territories of Indigenous people. Today, Arizona is home to 22 federally recognized tribes, and Tucson is home to the Odom and Yaqui. University of Arizona is also a Hispanic serving institution, and this means a great deal to me as I grew up here in Tucson, Arizona. I'm second generation Chicana, Mexican American, and I grew up in Tucson, Arizona. And if you look at this map here, you can see this is the US-Mexico border region defined under the 1983 La Paz Agreement to protect, conserve, and improve the environment. And so my lived experiences bearing witness to the strengths of the environment and the people, as well as the challenges that we're facing, really led me to the career I have today. What you see here is a picture of my great aunts. This is my Nana, her name, not Margarita, right, went by Maggie. And my Nana talks about holding my dad in to cross into the United States so that him and future generations could have more opportunities. I went to the oldest high school in the state of Arizona, so I'm a Badger for life, went to Tucson High. My grandfather refused to speak English as a form of political protest, and my dad dedicated himself to a job in worked a little bit in the mining sector as a miner, and then also building public health infrastructures along the US-Mexico border region, specifically within Arizona and Mexico. And so I grew up with an understanding that you pay for schooling, you go to school, and with that education, because it's a privilege, you serve and you work to improve. And so I want to highlight here that I'm a transdisciplinary environmental health scientist, meaning that I'm merging disciplines. So I have an ecology and evolutionary biology degree, a studio art degree with a minor in Spanish, a master's in public administration. I did a PhD in soil, water, and environmental science with a minor in art. And then I did a postdoctoral fellowship with an environmental sociologist. And so all of this comes together to the research program I have today, because we know that environmental racism is real and that we're striving for justice. So you saw some important statistics given by the host of this session. I'll just highlight here that we should be thinking about that our zip code can be more important than our genetic code. So with this effort, we strive for what's called structural change, that we want to create meso and macro level changes. So changing environmental legislation, enforcement, and protection. And one of the things that we know works when works well, and that disciplines across, scholars across various disciplines have come to the conclusion that when you engage those who are closest to the challenge in the solution generating dialogue, you get closer to structural change, meaning that participatory research methods, which there are 16 different terms that have been thrown out, that these are important. It's important to work with the communities in which are experiencing the injustice, the exposure, or the issue in the solution generating dialogue. And so these efforts, right, are transforming investigations. They're changing the way we're measuring the environment, the types of tools we're using, and the way we communicate. These processes begin with listening and humility, which then leads to partnership building. And so what you see here is this is where if I had more time, I would go through all the steps of how community members are participating in the scientific research process. But for today, I'm going to highlight a few. And one is partnership building and defining the research question. So some of the programs coming out of my lab are centralized around community questions. Are my soils safe? Can I grow and eat the food from my garden? If so, how much? Is my air safe to breathe? And are there pollutants in harvested rainwater? And rightly so, community members are asking this question because this is a map of the toxic release inventory data provided by the U.S. Environmental Protection Agency. And so you can see that here, if we zoom in on Arizona, we can see the sites that are highlighted here, and the larger the circle is the more release of contaminants. And so I work in these areas where there's these big circles and in the southern metropolitan Tucson area. And so here I'm showing you a bird's eye view of those locations. This is again the toxic release inventory data, and the others are showing these either legacy or active mining sites. And so I'm highlighting the location and also a year. That year is showing you how long when I started working with the community. So I've been working with Southern Metropolitan Tucson area since 2006, other communities since 2016, Dewey Humboldt 2018, and Superior 2008. Dewey Humboldt 2008, Superior 2018. And so with this efforts, and when you meet people where they are, you operate with cultural humility and you listen, this is where you start to engage more people. And so in the work, we can hear pulling from Crenshaw that I'm engaging people with multiple intersectionalities. You can see here that they are rural, they do not have a majority are rural, do not have a college degree, and identify as a person of color. And they're 25%, their dominant language is Spanish. And they're also having limited income. So if we look at these steps 4, 5, and 6, what we do in the lab is we design environmental monitoring kits, and so that community members can be trained and collect samples. So here's some images of them, like these beautiful soil samples coming from around Arizona, training in some of the plants that we receive. And one of the things we can do in the laboratory, so I don't mean to go crazy and looking at some data, but I just want you to see that this is showing a bioconcentration. This is the amount in the plant divided by the amount in the soil. And granted, I have the plant family names below. These are the common names. And what I want to show you here is that when it's accumulator, that means that it's greater than 1. When it's a hyperaccumulator, it's greater than 10. No need to get caught up in the details here. I just wanted you to see that the bioconcentration factors by plants varies. And if we look at manganese, we can see here that the concentrations vary. But one of the things that's standing out is Cactaceae. And so this is really important because we use nopales in our traditional Mexican cooking. And so it's important to be teasing out and looking at the food products and seeing how they're ensuring you're doing a culturally relevant exposure assessment and report back. This is a picture of training community members on how to collect dust, soil, and water samples. And in this work that we did together, we compared a inverted frisbee or disc versus a plant sample. And together we were able to prove that foliar surfaces, plant surfaces, are a successful low-cost air monitor and indicator of metal-laden soils or dust contaminated with metals. If we look at Project Harvest, this is where community members wanted to understand the quality of their rainwater. And here we can see, right, these are visual abstracts. This is where in Project Harvest, we have 2.5 years worth of data where we looked at industrial compounds like some perfluorinated substances, as well as pesticides. And here we also looked at metals like a metalloid arsenic and a heavy metal lead in the rainwater. A current project that I'm working on is looking at what are the impacts of wildfires and then subsequent flash flooding that occurs in rural communities that not only are rural, but they also are neighboring resource extraction and might be medically underserved. And so in this effort, this is the graphics being used, and we have an advisory board. We have 16 advisory board members from the community and from different stakeholder groups informing the project and how data results should be shared. All right, moving along to interpreting, disseminating, and discussing results. So this is a really exciting section. This is where you have your data, you've interpreted it, you're working together to interpret it, right? To understand like how to contextualize the information. You're sharing it to ensure translation into action. And then you're discussing it to ask new questions. And so here's just some of the these are postcards to invite community members to community gatherings and data sharing events. This is where we all come together, we eat, and we look at the data and we talk about it. Here is like where it might be traditional in a booklet format. And here's where we use an experiential art format where we had the water vibrate. So we converted all of the water concentrations to a vibration, sound waves. And then we basically put a tray of water on top of a speaker. And then a light would go off if it was exceeding a standard. Here you can see like the booklets, people looking through it, and then us having like these in-depth discussions about the results afterwards. We also make sure that we're presenting solutions and strategies to prevent and reduce exposures. And so here you can see these are best practices for gardening, and this is how to interpret your water data. In this case, this was used for the harvested rainwater. And so we took a lot of time making a visualization. This was, we did formative evaluations. So we worked with promotoras, community health workers, to talk about how this data should be, again, contextualized, and then how it should be shared. And so they really helped. We went through probably 17 different versions, and this was the final visual solution for reporting back all the data. And we could go online to look at them, but maybe we'll do that at another time. But you're welcome to look at my websites. And so what I'm excited and I'm going to end this talk with is one of the things is you do all this work, right? So I do community-based work. We come together, research questions, stems for the community. We train the community members. They collect samples based on their concerns and the exposure routes that's important to them to understand. All that data then gets reported back. And then we say, okay, what can we do with this information? And so this is where I use an environmental health literacy framework to understand what parts like the community scientists and others are gaining from this project. So if we look at this awareness and knowledge, we can think about that as literacy, environmental scientific literacy, as well as numeracy. Here's a quote from a community member saying, being able to see something that's at my home and I can see what happens there and that get these types of laboratory results that show exactly what's going on is really valuable. And that if I had any perceptions that different than what this booklet is, I have to reconsider and say, these are the facts. This is an exciting observation because somebody is reconstructing their mental map, right? They're really rethinking the way they understand their environmental health. And so this is important in a time where there's distrust in science, a lot of contestation, or people are challenging data. This is an important observation. We also saw that, unfortunately, due to the pandemic, we had to cancel the sampling season, but we wanted to stay in touch with our participants in Project Harvest. So we asked them, right, due to your basically due to your participation in Project Harvest. So sorry, let me back up a little bit. So with Project Harvest, we had to cancel the sampling season because of the high level of interaction. But what we did is we administered a survey because we wanted to know how people were adapting to the pandemic. And so we asked a question regarding now that you've participated, right here, you can see the question: due to your participation in Project Harvest and receiving result booklets with graphs, do you feel more comfortable interpreting COVID-19 data and graphs? And so what is exciting is that participants, you can see we have agree and strongly agree. So this was where, when we're designing the survey, Matoro was like, Monica, you've been reporting all these data backs over the years. I wonder if it's helped them interpret the pandemic data. And sure enough, we have data to show that it did. If we move on to self-efficacy and taking action, no need to read through this whole graph, just know that the actions participants were taking were rooted in the evidence and the data provided and supported. And now an exciting component is thinking about this community building and social engagement, community change, right? These larger scale actions. And this is where I want to highlight in Garden Roots, which is another project that I briefly mentioned. We did reveal that the public water utility was serving drinking water that exceeded the arsenic drinking water standard, or maximum contaminant level, under the Safe Drinking Water Act. This is where participants and community scientists worked together to notify others. We made sure the Arizona Department of Environmental Quality was aware of this, and we shared that data. And then sure enough, that water utility was issued a notice of violation and fined for exceeding the drinking water standard for arsenic. In this community, right, there's not too much time to go into it, but I want you to understand that I have this timeline. So mining has been going on since the 1875. And so this is an area where here's the former smelter and the mine tailings, here's the community. And this is the mural in the town hall where the body, right, the brown body is actually is a machine for extraction. So you can see how mining and the Mexican culture is rooted in this space. So this is a community champion who unfortunately passed away, but invited me to work along their side to understand the impacts of the smelter removal. We weren't able to set up a study right around that, but what we were able to do is Garden Roots. So people collected soil, dust, and water samples. All of that data was reported back. We hosted 4 events, and we had additional planning meetings with the coalition. And what's exciting is that after this, it led to new questions and people saying, what about these studies that were done in the past? How does Garden Roots that was done in 2019 compare to these past soil studies? And so that's where these community champions were like, people are moving into the area. We need to notify them about the potential for there to be contaminated soils, right? They should be aware that there might be contamination in their soils if they're buying a home in the area. And so this is where they wanted to make sure they notified people. And so we gathered this NSA data set and consolidated it with the Garden Roots data, and to help raise awareness. And we also hosted a soil shop with the state and federal agencies that community members could bring a soil sample and get their sample analyzed for metalloids, or arsenic and heavy metals, and lead is another example. Arsenic and lead. It was just arsenic and lead. And so what I'm highlighting here is like these are important, like what we call little policy or little movements towards structural change. And then to end on a quote from a participant from Project Harvest, this is exciting to see coming out of the data, is that now we need to see Project Harvest through the lens of the George Floyd protests and systemic racism. How can our science and Project Harvest experience, intersect, and or help to address this now? And what I want to highlight here is that this participant is saying our science, and they're seeing that our science has a social responsibility and a way to address systemic social justice issues. And in this case, our science is not perpetuating harm, it's being seen as a solution. And so what I want to leave you with, recommendations for the future, is to recognize that being educated is a form of privilege. When you're doing your work and your studies and in classroom settings, think about structural change as a goal. Evaluate root causes of identified environmental health risks. And recognize your positionality. So as I did an introduction, I talked a little bit about myself. And in this case, I'm a cultural knowledge broker. So I have an understanding of the community experience and the science, and this is enhancing the rigor and relevance of the work. Thank you all for listening, and big shout out to all the community researchers, scientists, and students that I've had the honor of working with over the years.
Great. Thank you so much for sharing your work today, Dr. Ramirez-Andreotta. We will go ahead with a few questions. If any of you have questions, please drop them into the Q&A box at the bottom of your screen and we can address them. All right. Dr. Ramirez-Andreotta, what environmental health hazards do you feel the Hispanic community is at most risk for, and what can be done to mitigate those risks?
So that's an outstanding question. So if you remember that I was bringing up in the beginning, like your zip code could be more important than your genetic code. So the way I would answer that is, like, we can take different perspectives. We could do like a place-based perspective and say like, and look at exposures around, in and around where the Hispanic populations are living. And so in the examples I showed, those communities that I'm working with, those specifically those rural, like rural mining communities, some of those, like they have a high percentage of Hispanic populations and like multiple generations of families living in that area. And so in that case, I think it's very important to be aware of, right, the types of pollutants that can be released by mining, so in this case, the metals that we were discussing. I would also, so that would be one example. If you were thinking about like, we have farm workers and thinking about that population, then we would need to be thinking about exposures to pesticides and other types of organic compounds. But the other thing is that, so it's like the biggest, if we could also take a perspective of like, what are health outcomes that we're trying to address? And is there a link or association to an environmental pollutant or environmental factor? And so that's another way to go about it. So I'm part of a research program where we're looking at the incidence of diabetes and obesity among Hispanic and Indigenous populations. And one of the hypotheses was trying to tease out what role arsenic exposure is playing in the incidence of diabetes and obesity. So that's an outstanding question. I think that it's like, there's different ways to come about and try to answer that. And so I just gave you a few perspectives.
Great, thank you so much. If there are any other questions, please drop them into the Q&A box.
Looks like you have one in the chat.
Thank you, Michelle. Your project was a great example of working with the community on identifying and addressing an environmental health issue. How can we take this example and work with our own local communities on an environmental health issue?
Yeah, so outstanding question. I mean, really, I like to give this like kind of broad overview to see what sticks for different listeners. And so one of the things in the beginning was talking about really meeting people where they are and recognizing community members as experts in their own right. And so one way to get started is to start attending like any town meetings, city hall meetings. Maybe there's community advisory board meetings around contamination. There's a public comment period that you could attend. There's non-governmental organizations that you could start working with to work with like community champions and to learn what's going on in the area. So really the biggest thing is to be humble, check yourself at the door and listen, have humility, and meet people where they are, whether that's through existing platforms and being hosted by local or state governments or non-governmental organizations and community-based organizations and community champions trying to address issues in their community.
That is great advice. Great advice. All right, any other questions? All right, well, thank you so much for your insight and sharing your experience and your knowledge today, Dr. Ramirez-Andreotta. We truly appreciate it.
Thank you very much for having me.
Of course.
Have a great rest of your panel. I got to jump off.
All right, thank you so much.
Thank you.
Next, we will move on to the next session of our seminar today with our environmental health expert panelists. Our panelists today are Captain Luis Rodriguez, who is an environmental health specialist with the Centers for Disease Control and Prevention, Water, Food, and Environmental Health Services branch. In this capacity, he provides overall leadership to the vessel sanitation program, as acting chief and section leader. Michelle DiMaggio has been a California registered environmental health specialist since 2002 and is currently the supervising environmental health specialist with Contra Costa County Health Services Department Environmental Health Division in California. She is also an active member of the Contra Costa Health Services Department Emergency Management and Foodborne Illness Outbreak Investigation teams. Vanessa Zarate is an Arizona native and graduate of the University of Arizona. She currently holds the role of Environmental Health Supervisor in Consumer Health and Food Safety for the Pima County Health Department, where her focus is with the Food Safety Program. Our panelists will take turns sharing their stories with you of working in environmental health. As a reminder, if you have any questions for the panelists, please feel free to drop your questions in the Q&A box and we will address them following all their stories. All right, so let's begin with Captain Rodriguez. Please share your career's journey into environmental health.
Thank you. Thank you very much. It's an honor to be here. And yeah, my name is Luis Rodriguez and I was born and raised in Puerto Rico, an island that we all know is a beautiful place, but also at the same time, it's in the Caribbean where we have all this rain and hurricanes. And so how did I end thinking of environmental health? I would say I was one of those that like so many things, and I couldn't decide if I wanted to study a certain science. I knew that I liked sciences. So I wanted some interdisciplinary area. So when I knew about environmental health, it seemed like a very nice fit. I like sciences, I like health. And that was about the same time that we all always had like hurricanes. And I was like very, very identified on how we could help people in our Hispanic community, of course, in Puerto Rico. So that was kind of my way into the field. I started in the Food and Drug Administration as a consumer safety officer, a little bit like almost 21 years ago in San Juan, Puerto Rico, doing inspections of food, medications, and medical devices. Then I moved to Maryland about doing the same thing, then came to the Centers for Disease Control and Prevention, CDC, in Fort Lauderdale, Florida, for the vessel sanitation program. And if you didn't know that environmental health officers are the ones keeping the cruise ships in check and healthy, now you know. It's a little group, very, very special program, and it's almost everybody is an environmental health officer. And now I'm in Atlanta, and we're housed in the National Center for Environmental Health. What else I can tell you? So within this program, we do the public health inspections on cruise ships, and we deal with everything. I mean, food, water, potable water, recreational water, pest management, the air that we breathe, ventilation, medical. I mean, all these areas have an infirmary or medical center. So we do surveillance and some epidemiology as well. So it's great. I mean, and here in the back, I kind of try to do a little bit of a collage of things that I have done. So you can see, looking at charts for potable water and recreational water levels. There I am next to that in a community shelter. Afterwards, like there, I'm checking the water in a community center for halogen residuals and Legionella. That was a fountain. And the other one, like you see some kind of oh, what is that environmental health officer doing with that instrument for checking the eyes and the vision? So that is one of these humanitarian missions that you can get involved as well. And after you do all your water checks, all your food checks, you still have some energy, you help out. Construction of new ships that's there in the shipyard. Let me see what else is around there. Yeah, checking food temperatures and everything is hot if it's supposed to be hot and cold if it's supposed to be cold. So that's a little bit of me, and something that I will really love for you like to take away. If it was very hard for me at first to leave the island, my community, my known everything, right? But it was great just to expand. So if you have the ability to just go out your area, and you will learn a lot. And if you can get involved with the community, you can get involved with the associations like NIHA as well. Your profession, I mean, your journey in environmental health will be very bright and long as well. So, I mean, that's about what I have now.
Great. Thank you so much, Captain Rodriguez. That was very inspiring. I will pass it over to Ms. DiMaggio. Please go ahead and share your story with us.
Good afternoon, everybody. As you know, my name is Michelle DiMaggio, but my maiden name is Garcia. So my name is Michelle Renee Garcia. DiMaggio is my maiden name. And yes, my ex-husband was related to Joe DiMaggio. That's a question I get all the time. But my story is a long road. First, I am third and fourth generation Chicana, as was mentioned. I have a strong military family background. Multiple uncles, including my step grandfather in World War II, in Vietnam and Korea, and my brother was in the Marines, so strong military background. However, in growing up in my family, I grew up on the east side of Salinas. So if you knew Central California, Salinas is on the coastal side of it. And the east side was not considered a good side of town. I came from that bad side of town. I had my positive and my negative influences. My positives were the females in my family, especially my mom. My mom owned a restaurant, but before that, she also ran for city council. She was a strong influence, and especially from a woman that had her first child at 17 and got away from an abusive relationship. So she was my hero. As well as my grandmother, who was one of the Rosie the Riveters in Oakland, California, and my aunt, who marched Cesar Chavez marches and was a true hippie at heart. So I learned a lot from these women. Consequently, because of my mom worked all the time, I was what you would consider a latchkey kid. So my brothers and my sisters were my influence. At that time, we didn't really call them gangs back then, but if you would see them and see how we grew up, you would consider them gang type activity. And that's how I grew up. I was a smart kid, thank God. So I kind of knew what my boundaries were to a certain point. My mom put me back in my boundaries when I needed to. And I was lucky enough and smart enough to get through high school. I knew what I needed to do, but the only class I really loved in high school was biology. So I think that's where my root was. I did go to, as soon as a little while later, it took a few years, I went to junior college. My mom wanted me to take over her restaurant, so I started off in business. My ex-husband at the time was going to university, so I got my associate degree and decided to go to university. My mom helped me get my business degree. However, I wanted to take a biology class again. So I took cell biology, fell in love with it, changed my major to biology. I did have some experiences afterwards. I had a concentration in entomology. So I started as an ag biologist with California Department of Food and Agriculture, and then moved to Contra Costa County Vector Control District, where I was considered the rat lady, the one that went to go and trap the rats and test the rats and got to do hantavirus, plague, all that fun stuff. And then from there, that's when I learned about environmental health. From that point on, I never knew environmental health. And no, my mom had a restaurant. So when I told my mom when I applied for environmental health, you know what she asked? She said, "Why do you want to do that? My inspector just went, walked in, sat down and ate." So I had to convince her I was not going to be that kind of an inspector. Um, in environmental health, I loved it. I loved working outdoors. I loved talking to people. However, my challenge is my Spanish was not very good. I understand it. We didn't speak it at home. None of my friends spoke it. If it was Spanish that time in the 70s and early 80s, it was in the home. So all I knew was I understood it, but was uncomfortable speaking it because I didn't speak it very well. So that was my huge challenge. However, when it came to restaurants, and my weak point were women who owned restaurants. I would try to help them as best as I can, connect them with any kind of city um, uh, grants that they might have, or the Hispanic Chamber of Commerce, anything that I thought that would help them. Because I think I was going back to my mom and looking at these women. And currently, after 20 something years and still in environmental health and the retail food program, still have in my mind is how can I help one, the Hispanic community, and we are doing that in our county, but two, especially the my brothers and sisters in Hispanic community who are in the university right now and they don't know about environmental health. Environmental health is an awesome, awesome career. It's fun. It can be stressful. Yes, we get our challenges, um, but it's a career that helped me become who I am today. Not only because of my positive and negative influence that I've had in the past, that built my base, but environmental health and NEHA, National Environmental Health Association, helped build me up to become the person I am today. So if you're looking out there for careers and maybe you don't see right now an environmental health table at your career fair, take a look at some of our websites. Take a look at NEHA's website. NEHA has many opportunities for you that might be out there. And at the end of my presentation, I'm going to put a link to the California Department of Public Health Registered Environmental Health Program. Because in California, for those out of university that meet the criteria, they can apply through the California Department of Public Health, and they receive a letter if they qualify, and they can apply at each county. And we are desperately looking for environmental health specialists, especially, I have to say, as you know, in the kitchen and a lot of work areas, there are many Spanish speakers and people, especially that their English is not very well. And we really would like to look for persons who are able to speak Spanish and communicate to help that community become stronger, and especially in the retail food team, and especially in the retail food world. It's continually changing, but if we work together with them, it'll be a positive change. And that's my story.
Great. Thank you so much, Mrs. DiMaggio. Lovely story. I love it.
Thank you.
And we will move on to Ms. Zarate. Please share your journey into environmental health with everyone.
Thank you, Nicole. My name is Vanessa Zarate. I'm an environmental health supervisor in Pima County, Arizona. The major city that is in Pima County is Tucson. So we are a pretty good sized population, just over 1 million in our area. My environmental health journey started off kind of by accident. I kind of fell into environmental health. It was not what I intended to do. A little bit about my background is I grew up in Arizona my whole life. And grew up in different mining camps around Arizona. My family was in mining. One of the major mining companies here in Arizona went to my grandfather's village in Mexico and said, we'll help you become a US citizen if you come work for us. And so that's how my family made their way into the United States. And so I have 4 siblings, and of my 4 siblings, 2 of us graduated high school. And I'm the only one that went off to college and did graduate college. I graduated with a degree in nutritional sciences, thinking that I would go the route of being a registered dietitian. However, when I graduated, I was not in a position to go into an internship. Registered dietitian internships are costly and time consuming, so it just wasn't the right time for me. So I thought I would get my foot in the door at the health department and start looking for some nutritional and dietitian positions there, and they didn't have anything open, so I applied to be an environmental health specialist and thought this would be my foot in the door, and when something opens up in dietetics or nutrition, I could move over. However, after a year working with the environmental health division, I was really enjoying myself. I loved the work, I loved the people, and decided that this is where I wanted to be, was in environmental health. My division, we have a vector program where we focus on mosquitoes, recreational water, swimming pool inspections, some institutional inspections, and we have a whole food program. And I've spent most of my time in the food program, originally being hired for mobile food units, which in Southern Arizona is very heavily owned by the Mexican American community here, and where Spanish is really necessary. So we are always looking for more Spanish speakers to help us out. A lot of our restaurant operators, as well as our food truck operators, are Spanish speaking, and we're really looking for more people that can help us with that. We do have other ways of communicating with them, but having a Spanish speaker is always a benefit over using translator services, because they are able to not just understand each other in a conversation, but also that connection of understanding each other's cultures and where they come from. And it really builds that rapport and that trust that's really necessary when you're trying to change behaviors in a restaurant to protect the public. And so that's a little bit about myself and how I got into environmental health. Thank you.
Thank you, Ms. Zarate. Thank you very much for sharing your story. Now we will go ahead with any questions for our panelists today. Again, please utilize the Q&A box at the bottom of your screen. I would actually like to kick it off with a question. Ms. DiMaggio, if you wouldn't mind, why would you say Hispanic representation is essential within the environmental health workforce?
That's a good question, and Vanessa pointed to it as well, is especially in the retail food program. Many business owners, many mobile food vehicle owners, now in Contra Costa County, we call them, or in California, we call them compact mobile food basic of units. There's a lot of new laws coming in place, especially in California, where they are probably about 95% Spanish-speaking owned owners. So our team that I have now, we have probably about 4 Spanish-speaking inspectors out of 25. And we have other speakers as well. We have Korean, we have Chinese, we have other speakers, but those that go into the restaurants, if something's wrong, we don't want to discipline them, we want to educate them. And the only way to educate and collaborate and make them feel comfortable with us, because I think the biggest thing is trust. They don't trust. And I understand that is we need to just let them know that we're there to educate so that something doesn't happen in the future. And that's the biggest thing. If we can get people who are speaking Spanish speakers, start building that trust and that communication.
Great, thank you. Vanessa or Luis, would you have anything to add to why Hispanic representation in environmental health is important?
I do, and you know, in looking at it in the bigger context, a diverse workforce also promotes cultural competency, and you know, you drive programs to be more effective, and same as interventions, as that one that was featured in the beginning, the soil shop, for example, that the person going there is understands the culture. That's a big one. That's very big. And you know, also when you don't have enough representation, you have the dominant groups deciding for the non-dominant groups. It's hard. You have an imbalance there. So it's not only like during inspections or that is so important, and just for me being bilingual has helped me during all my career, but also at the policy level, just bringing that perspective of diversity helps a lot.
Absolutely. Thank you. Thank you so much. Vanessa, what is the goal or outcome that you seek to achieve through the projects that you're working on currently?
The goals and outcomes are really to, find that common ground, because education is so much more important than the enforcement side. And we always want to go education, as Michelle was saying. And it's so important to build that bridge and make those connections and that trust within the community so that we can change those behaviors and have that opportunity to educate rather than enforce, because it never goes well when we have to do the enforcement route. They don't trust us. They're only changing for that moment that they see us. Everybody's hiding things when the health inspector drives up to the front of the building. And that's, not how we want to operate. One of the things that we did, and this isn't recent, but I think it's a really great story to show how we can build those relationships. Tucson is actually the first city of gastronomy. And if you don't know what gastronomy is, it's highlighting and preserving the traditions and native foods in your area. And it also a lot of restaurant owners also like to revitalize them and take those recipes and make them in new ways that are more trending. So it keeps us busy, keeps things interesting on our day-to-day to see how these things will work within the food code and keep them safe. Our region, the food is known as Sonoran Mexican food because we're right bordering Sonora, Mexico. And one of the things that we're really famous for is a Sonoran dog, which is a bacon wrapped hot dog. Sounds simple, but it is something that everybody's really proud of. And we have a hot dog cart on every street corner, sometimes two, selling these Sonoran hot dogs. So hot dog carts were really important to us. And in 2019, the state decided to create a mobile food law that would allow mobile food trucks and carts to be governed by the same code across all counties, so that they could easily go from county to county with their food truck and not have to make modifications to their cart or their truck. And when it first came out, it would have shut down all our hot dog carts. It did not allow for any raw product, therefore they wouldn't be allowed to use their bacon on their hot dogs. So it was really important for Pima County to advocate for them and make sure that that made its way into the legislation in the second draft. And that was us extending a hand to the community and making sure that they know that we value what they do and know that what they do is important for our community, for their livelihood, and kind of an olive branch to let them know that we are advocating for them and not just regulating them.
I think that's a great example of representation, as well. Same time. Absolutely. Thank you so much.
Thank you.
Michelle, what would you like for students to take away today from our seminar?
Environmental health is fun. One sentence. It's very diverse. It's growing. And we started off with, and Neha has a great story on their webpage, but we started off, what is environmental health? Now we're out there, and it's a career that it's been around for many, 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 many years, but now we're at the point where even the Congress is starting to get notice of us. So if that happens, there's great opportunities in the future. So environmental health is fun. Get into environmental health, and we are here for you. Any level of workforce you want to get into, just reach out. And I'll put the California REHS program in the chat.
Great. I'm glad you mentioned what you just mentioned. The White House just addressed environmental health this past week. Look it up. It was a very great letter. Any last comments from our panelists today?
So I just want to echo what Michelle said. Environmental health is fun. There's a lot to do. It's very impactful in the community. So for students, get involved with your associations, local or NEHA, the national level. Look for internships. Look to get involved with the community, and you only need like a will and drive, and you will be very successful.
Absolutely. Thank you for that. All right. Thank you so much to all of you, Captain Rodriguez, Ms. DiMaggio, and Ms. Zarate, for participating in today's seminar and panel discussion and sharing your stories of how you entered and got into environmental health and the changes that you are making. We truly appreciate it. We will finish up here, just a couple more moments here. Michelle, if you would go to slide 17. So this year, NEHA is hosting our 86th annual educational conference in New Orleans, Louisiana, July 31st through August 3rd. The theme this year is Raise the Voice of Your Environmental Health Workforce. The AEC provides a unique opportunity to network with hundreds of environmental health professionals and those just beginning their careers in environmental health. You can get more details at our website, neha.org/AEC. Let me share with you that our keynote speakers at the educational conference this year are going to be Maureen Lickfield, who is the Dean of the School of Public Health and a professor at Jonas Salk, and retired Lieutenant General Russell Honore, commander of the Joint Task Force during Hurricane Katrina. I would like to thank our speaker, Dr. Monica Ramirez-Andriota, and our panelists today for partnering with NEHA and providing great content to all of our attendees. And thank you all for attending today's seminar on the impacts of environmental public health hazards on Hispanic communities. Please complete the evaluation that you will receive after the seminar ends. We would greatly appreciate your feedback, your comments, and your recommendations. And please feel free to contact us anytime through our website or by email at support@neha.org. Thank you again. We hope you enjoy the rest of your day.
Thank you.
Thank you.